My name is Dr. Hidayath Hussain. I'm a pulmonologist. I'm talking about the sleep disorders. It's called OSA, that's called as Obstructive Sleep Apnea syndrome. In this condition, you see that a lot of people, they're snoring a lot, and in addition to that, we feel that patient in addition to snoring, daytime he's sleepy. So that condition called as sleep apnea syndrome. Whereas snoring, we feel that the patient is snoring. When the patient is snoring, we feel that patient is sleeping comfortably, but it is not so. He's snoring because the amount of oxygen going to the lungs is depleted, and he starts retaining his carbon dioxide. That patient can worsen, and slowly he's going to develop condition called asthma, called sleep apnea syndrome, wherein they put on weight, and also they start developing breathlessness and snoring, and in addition to that, the right heart failure is going to start developing. How to treat these patients? First is diagnosis. First you should diagnose the OSA, take a proper history, and do a study called a sleep study. That has to be done. Overnight sleep study has to be done. In that, once the report comes, we should do one more test called EEG, and one is called as 2D echo. We should do complete workup. Also, some patients are smokers. That patient PFT is mandatory for such patients. Once PFT is done, 2D echo is done, EEG is done, and sleep study is done, we can come to exact conclusion what has happened to the lungs, to the patient. When the diagnosis is there, should treat by a machine called CPAP or a BiPAP. So BiPAP depends on the patient's condition on ABG. When the patient is retaining carbon dioxide, BiPAP is mandatory. The patient is not retaining carbon dioxide, it is called CPAP is mandatory. And once you start using this drugs, this machine called CPAP or BiPAP, the quality of life is very, very good. Patient is snoring reduce, even his BP will get controlled, and obesity also can get controlled. And the treatment is a bit long. Lot of patients depend on the sleep study. Once the AHI is calculated, when the AHI is very, very high, probably some patients require CPAP for a very long time. Probably sometimes they require lifetime also. In between, the patient can reduce his weight, control of his BP and sugar, and losing weight. The patients can be off BiPAP or CPAP, and the treatment is very, very easy, but diagnosis is very, very important.